Hi, let's see an NCLEX RN video based on the assessment of cardiovascular function. A good assessment of cardiovascular function will help you to understand cardiovascular disorders. First question, what is the composition of the heart? 4 chambers with 4 valves that control flow through the heart and lungs through changes in pressure. 4 chambers and 4 walls that control flow through the heart and lungs through changes in the oxygen level. 2 chambers on the right receiving blood from the high pressure venous system and 2 chambers on the left sending blood into the low pressure arterial system. 2 chambers on the right receiving oxygenated blood from the venous system and the 2 chambers on the left receiving deoxygenated blood from the pulmonary circuit. So flow from the heart is controlled through changes in the pressure, not oxygen. So the second one got wrong. The arterial system is a high pressure system and venous system is a low pressure system. Deoxygenated blood is returned to the right heart to be circulated through the lungs for gas exchange, and oxygenated blood then flows through the left heart to the systemic circulation. So here the correct answer is 4 chambers with 4 valves that control flow through the heart and the lungs through changes in pressure. Which is true of the electrical conduction system of the heart? It is primarily controlled by the movement of uncharged ions. It has a positive resting membrane potential. It is reflected in the waveforms on the ECG. It requires cells that respond only to stimulus from the autonomic nervous system. Talking about the cardiac conduction system, the electrical conduction system is controlled by the movement of charged ions across the cell membranes. They have a negative resting membrane potential, not a positive resting membrane potential, and is composed of cells with the property of automaticity, which is reflected in the waveforms on the ECG. So the answer is it is reflected in the waveforms on the electrocardiogram. A patient with hypertension has which physical symptom? Decreased resistance, which may increase cardiac output, increased resistance which may decrease cardiac output, increased resistance which may increase cardiac output, and decreased resistance which may decrease cardiac output. You know that cardiac output is the amount of blood ejected from the left heart. When there is hypertension, there is increased resistance. Increased resistance may result in decreased cardiac output. So in hypertension, increased resistance is there and that decreases cardiac output. You have to keep in mind, if resistance is less, the cardiac output will be more. Nurse is providing care for a patient newly diagnosed with heart disease. Which dietary activity or lifestyle modification should be included in the plan of care? Select all that apply. Stop smoking, drink lots of water, limit the sedentary lifestyle, eat a diet rich in red meat protein, limit alcohol. When we are assessing the history of the patient, there are non-modifiable risk factors and modifiable risk factors for heart disease. The non-modifiable risk factors are age, sex, ethnic background. And if you talk about the modifiable risk factors in patients' health history for a heart diseases, their weight, their dietary habits, alcohol consumption, and smoking history. Excess consumption of fat and sodium in dietary habit puts a patient at risk for heart disease. And smoking and excessive drinking are also implicated in heart disease. Activity level should be assessed. A sedentary lifestyle is a risk factor for cardiovascular disease, and exercise promotes cardiovascular health. So here, what are the modification required is, one is patient need to stop smoking. Second one, they need to limit their sedentary lifestyle. They need to increase their activity. And third one, they should limit their alcohol. So these are the three things which need to be modified. And patient should not be told to drink loads of water, as the heart may not be able to handle excessive fluids. And red meat protein also must not be taken in too much. It is a risk factor. What is the most likely procedure to determine the cause of severe chest pain in the patient newly diagnosed to the hospital? Coronary angiography, nuclear stress testing, right heart catheterization, TEE. Coronary angiography is done to specifically evaluate the coronary arteries. So here, when a patient is coming with chest pain, we need to suspect some coronary artery diseases, and coronary angiography should be done. Stress testing evaluates the heart functioning during times of increased workload. Right heart catheterization, it evaluates cardiac filling pressures, cardiac output and valvular function. TEE, that is transesophageal echo, that evaluates the posterior aspect of the heart and the presence of clots. So here coronary angiography can be done as the procedure. What is the important nursing action post cardiac catheterization interventions? Early mobilization to prevent clot formation, fluid restriction to avoid fluid overload, bed rest to avoid stress on cannula insertion site, head of bed at 30 degrees for respiratory support. So here, when we talk about cardiac catheterization, you need to know that it is an invasive X-ray procedure during which a radio-opaque catheter is advanced through an artery or vein to the heart, and it is under fluoroscopy in order to evaluate the cardiac filling pressures, cardiac output and valvular function. A right heart catheterization can be done through a suitable vein, can be a femoral vein, brachial vein or subclavian vein, and the catheter is advanced to the right heart via the inferior or superior vena cava. A left heart catheterization is done through a suitable artery, femoral, brachial or radial, and the catheter is advanced up through the aorta and into the left heart. Once this cardiac catheterization is done, the post-procedure nursing interventions include: first one, maintaining the patient on a flat bed rest for 2 to 6 hours to prevent stress on the insertion site, which may cause bleeding. Second one, observation of the catheter insertion site for bleeding or hematoma formation. Third, cardiac monitoring and frequent vital signs. Fourth, monitoring the patient for chest pain. Fifth, assessing for signs of stroke such as confusion, weakness or slurred speech. Then monitoring the peripheral pulses, their color and temperature in the affected extremity. Monitoring the urine output secondary to the osmotic diuresis caused by the contrast dye. Then maintaining a sufficient oral or IV fluid intake to ensure renal clearance of the dye and to maintain adequate hydration status. Obtain blood work to assess the renal function, hemoglobin, hematocrit and coagulation studies. So here the most important nursing care is bed rest to avoid stress on the cannula insertion site. Fluid restriction should not be done, and that day we should not go for a mobilization, and the patient should be kept flat on the bed. What information should be in the teaching plan of a 76-year-old patient after a physical? Initiating a new strenuous exercise regimen is recommended. Limit physical activity and exercise. Report any new or excessive fatigue. Excessive fatigue is not unusual as you age. So here, excessive fatigue is not normal and may indicate the onset of a heart failure. Physical activity should be continued, but we should not go for a new strenuous exercise regimen. What laboratory values are significant indicators of acute heart injury? Which laboratory values are significant indicators of acute heart injury? Increased CK and myoglobin, increased CK-MB and troponin, decreased BNP and platelets, increased CK with low levels of CK-MB. So here you need to understand about the laboratory predictors and markers of heart disease. So here for this particular question, creatinine kinase CK is a general marker of cellular injury. It is released from the cells in the brain, skeletal muscle and cardiac tissue after muscle damage has occurred. One isoenzyme of the CK, creatinine kinase, that is creatinine kinase myocardial band, that is CKMB. It is the marker which is specific for cardiac tissue. When myocardial damage occurs, CKMB, creatinine kinase myocardial bands are released from the cells. Increased levels can be seen at 3 hours after myocardial damage and can remain elevated for up to 36 hours before returning to normal. So increased CKMB and other thing is troponin. These two are the significant indicators for acute heart injury. Let's see about this thing more. So this is the lab test, the normal values and the cardiac markers and normal value. If you first see the lipid profile or the lipid panel, it includes the total cholesterol, then low density lipoproteins and high density lipoproteins along with triglycerides. So these four, cholesterol, LDL, HDL and triglycerides, are seen in the lipid profile or lipid panel. Cholesterol is a lipid necessary for the synthesis of hormones and cell walls. It is available in all the animals, and this low density lipoproteins, this LDL transport the cholesterol into the cell, but it can also deposit the cholesterol in the walls of the arterial vessels. So if low density lipoproteins are more cholesterol will be deposited in the arterial walls. So what you have to see, this low density lipoproteins must be less than 100 mg per dl. And this high density lipoproteins, they are protective lipoproteins. They transport the cholesterol away from the cells to the liver for excretion. So HDL should be more. Its value should be more than 40 to 60 mg per deciliter, means it is a good thing. If the level of HDL is decreased, that is a risk factor for heart disease. And the total cholesterol means this HDL plus LDL, and the normal value should be less than 200 mg per deciliter. Increased level of cholesterol also is a risk factor of atherosclerotic vessel disease. Then triglycerides. Triglycerides, another lipid. It is stored unused indigested calories in the fat cells, and during emergency the energy is released from the triglycerides. Elevated level, that is greater than 150 mg per deciliter, shows a risk factor for heart disease. So this is about the lipid panel. Then you know that there are non-specific markers like the glucose and all. Diabetes and hyperglycemia are major risk factors for coronary artery disease or cardiovascular disease. So the glucose, if it is in the range of 65 to 99 mg per dl, it is a good thing. and if the values are elevated, that means the patient will be having more risk of cardiovascular disease. Homocysteine, an amino acid, is a risk factor of heart disease if it is in increased amount. Decreased dietary intake of folic acid and B vitamins is associated with the increased level of homocysteine. So we need to take more folic acid and B12 so that, or B vitamins, so that the level of homocysteine will be in the normal range. Then C-reactive protein. It is not specific for cardiac disease, but it is used in conjunction with other laboratory studies. Elevated levels, it reflects increased production of C-reactive protein in the liver secondary to any systemic inflammation. Inflammation is implicated in the development of atherosclerosis. So C-reactive protein should be normally 0. It will be only present if any values are there, means it is present when some inflammation is there. So C-reactive protein should be 0. And another coagulation studies such as platelets, fibrinogen level, prothrombin time, then partial thromboplastin time, international normalized ratio. These coagulation studies also are commonly obtained for the screening purpose. Increased platelet and fibrinogen levels are corrected with an, or it is correlated with an increased risk of atherosclerotic heart disease. And prothrombin time, partial thromboplastin time, and international normalized ratio. It shows that there is an increased risk of clot formation, especially in patients with atrial fibrillation. So you need to see for their normal values also. They should be monitored. And one important point to check for this lipid panel, the patient should be fasting for approximately 8 to 12 hours prior to the test. Then we talked about the cardiac markers. There are mainly 4 cardiac markers. One is CKMB. We know that CK is the general marker for cellular injury, and CKMB, creatinine kinase myocardial band, is specific to the cardiac tissue. If the value is increased, means there is some myocardial damage. And another thing is troponin. The troponin is specific marker of cardiac muscle damage, and it is a preferred method for diagnosing cardiac injury. It is the protein that is released from the damaged tissue, and it can elevate within 4 hours of injury. It stays elevated for up to 10 days. Because it stays elevated longer than CKMB, it is a valuable marker when attempting to diagnose injury in the recent past. So troponin value we have to see. Then myoglobin is another protein is released and elevated in muscle damage, but is not specific for cardiac muscles. We need to tell this myoglobin, and it can be used in conjunction with other values to rule out the myocardial infarction. Then the last one, brain natriuretic peptide, BNP. It is released from overstretched ventricular tissue. Physiological response to increased level of BNP include venous dilation, which decreases the preload, and also arterial dilation, which decreases the afterload, and diuresis. The elevation of BNP also indicate a heart failure. So nurses need to obtain CKMB, troponin, myoglobin, and BNP. These are the cardiac markers, and this is one thing which is important in identifying the heart disease. The nurse anticipates what procedure for the patient at risk for stroke because of the potential presence of blood clots in the right atrium. Here the question itself is asking the presence of blood clots in the right atrium, how can be found out? Is it through a nuclear stress test? TEE. TEE is transesophageal echocardiogram. Then coronary angiography and chest X-ray. The answer is transesophageal echocardiogram. TEE can identify the presence of clots in the atrium, which can be a risk factor for stroke. And also it provides valuable information about the posterior aspect of the heart, such as the left atrium. If you are going for a nuclear stress test, it identifies the areas of poor perfusion, and the coronary angiography looks at the blockages in the coronary arteries. Chest X-ray is used as a general screening exam to identify any enlargement of the heart or any pulmonary infections and all. The nurse has just received a report on assigning patients. Which of the following patients should be assessed first? The patient with indigestion and an increased troponin levels, the patient with indigestion and increased CK levels, the patient admitted 2 days ago with a BNP of 75 pg per ml, the patient admitted 2 days ago with increased LDLs and C-reactive protein. So here, indigestion is sometimes an indicator of myocardial infarction, and increased troponin level, they both shows there is an acute injury to the myocardium. The second patient, there is increased CK. It is non-specific for cardiac injury, so the patient may be just simply having indigestion. And the third patient, the BNP value is at the normal range, and the fourth patient just needs an evaluation. The nurse is screening patients for the risk of developing heart disease. The nurse should consider which patient at greatest risk. A 60-year-old obese male smoker with a family history of heart disease, a 40-year-old female who drinks 2 glasses of wine every day, a 70-year-old male smoker with a long-standing history of hypertension, a 50-year-old female smoker with a family history of heart disease. So here when you are seeing all the patients, everyone is having risk factors. But now we need to count which patient has got the maximum number of risk factors. If you see the first patient, the patient is obese, then the patient is a smoker, and the third risk factor, the patient has a family history of heart disease. That means 3 risk factors are present in that particular patient. For all other patients, there are 1 or 2 risk factors. So this first patient is at the greatest risk. Altered levels of sodium, potassium and calcium may result in what condition? Fluid loss, fluid retention, dysarrhythmias, shortness of breath. So here the patient who are having problems with their levels of sodium, potassium and calcium, they have problems in their heart. Dysarrhythmias are more problematic because of disruptions in the action potential. All these 3 can result in changes in the action potential and create problem to the cardiac system. A 70-year-old Caucasian male has no significant past medical history, takes no medication and has no allergies. He is overweight and drinks about 5 evenings a week. He quit smoking 2 years ago. He does not exercise but does do heavy lifting work around the house. Family history includes paternal death at 60 due to MI. His examination reveals BP 145/90 mmHg, heart rate 84 beats per minute, regular respiration 16. His physical examination is unremarkable except for his stage 2 hypertension and excessive weight. You need to just have an understanding. Stage 1 hypertension is when the patient is having The systolic pressure 130 to 139 mm of Hg and diastolic 80 to 89 mm of Hg, and stage 2 hypertension is more than 140 mm Hg, systolic and diastolic more than 90 mm of Hg. Here the patient has stage 2 hypertension. His neurological, respiratory and cardiovascular examinations are within normal limit. He is scheduled for an ECG and laboratory analysis to include electrolyte, glucose, cardiac, renal and liver parameters and a cardiac exercise stress test. The laboratory findings: cholesterol 220 mg per dl, so that is increased. Low density lipoproteins, it should have been less than 100 mg per deciliter, but it is more than 180 mg per deciliter. HDL, high density lipoprotein, should be less than 40 to 60, but here it is less than 20, it is 20 mg per deciliter. And otherwise everything is normal limit. Exercise stress testing reveals shortness of breath and fatigue on exertion. ECG reveals normal sinus rhythm with a rate of 85 beats per minute. In general, the patient is overweight by nearly 30 lbs. Cholesterol and LDLs are slightly elevated. HDL is slightly decreased and the patient has stage 2 hypertension. So this is the patient's assessment and history which we have taken for the cardiac assessment. What is Mr. John's modifiable risk factors? Select all that apply. Weight, family history of heart disease, dietary pattern, drinking history, homocysteine levels. So modifiable risk factors includes he can control his weight, and another, he can have a check on his dietary pattern and also his drinking. What statement indicates further teaching is necessary? My family history makes me worry. Changing my eating habits is hard. I will talk with my doctor before starting an exercise program. My blood pressure is not so high. The patient is in stage 2 hypertension and he is telling it is not too high. It's a problem we need to. Which instructions are appropriate for Mr. John? Lose weight, exercise, limit alcohol, prepare for coronary angiography, schedule an ambulatory ECG, plan for a TEE. So here we need to give instructions like the patient need to lose weight, exercise regularly and limit his alcohol. Which information should be included in the teaching plan of Mr. John? Select all that apply. Check your BP frequently. Start running as an exercise program immediately. A diet limiting carbohydrate in favor of fat and protein is advisable. If you must drink, limit it to 1 drink per day. If you must drink, beer is better than wine. So here we need to advise for checking BP frequently, and also if he has to drink, limit it to 1 drink per day. This can be included in our teaching. Hope you understood this video on assessment of the cardiac system so that the later videos will be helpful for you. Thank you so much.